It came about just interacting with doctors as a young kid. I always remember how good physicians made me feel. And good doctors will address your concerns and try to comfort you through a sometimes difficult time. And that for me was something that really drew me to medicine, having the opportunity to make people feel that way. And using things that I learned in a textbook or in clinical experiences to help enrich people's lives. When I rotated with the perinatal group out at Methodist Women's, I realized A, we are clinically interested in the same things. B, we put a heavy emphasis on relationships with those people we work with and our patients. And C, ultimately, I was happiest in that environment. And I think all of those things together really drove me to want to do maternal fetal medicine. Pregnancy care can be really complex. You have two patients, the mother and the baby. Balancing both mom's life, baby's life, and having a successful pregnancy can be really difficult. It requires a lot of expertise and care, but it also requires a lot of teamwork. There is a population of patients that I feel we can make a huge difference on, and that's patients with diabetes. Treating diabetes appropriately and having that diligence to treat blood sugars and treat that disease, you can make lasting impacts on both mom and baby. I can be personable and I can be sometimes goofy, but at the end of the day, I am very serious about the health of the patient in front of me. The most important part in my job is the relationships with patients. Pregnancy care can be a very emotional time for mom and for the family. Being there to experience the highs and the lows is something that can be incredibly rewarding for me.